Good evening, and thank you for joining tonight's webcast. We're coming to you from all around the Americas. My name's Ted Lewis. I'm in San Francisco, and we're happy to have with us tonight Barb Netterpel, who's the president of the Hospital Employees Union of British Columbia. She's coming to us from Kamloops, British Columbia. Marco Castillo, who's the U.S.-Mexico Program Director for Global Exchange. He's in New York City. We have with us also Laura Carlson, a journalist and social movement analyst in Mexico City, who runs the Americas program. We also have Natalia del Campos, who's the co-founder of the Defend Democracy in Brazil Committee in New York. She's coming to us tonight from Sao Paulo, Brazil. And from Colombia, Alejandro Castillejo, a professor of anthropology at the University of the Andes in Bogota, Colombia. Natalia Green from Ecuador, who is the president of the Coordinating Entity of Environmental Organizations of Ecuador. And finally, last but not least, John Giuliano, executive director of the Tamarindo Foundation, a youth community center in Chalatenango, El Salvador. So we have people from around the hemisphere, and we're looking forward to hearing from all of them. If you are out there and would like to share this with your friends on Facebook or the people in your organizations, please take a moment, and Marco Castillo will explain to you how to do that. Right after that, we're going to go into a video that we recorded with a doctor on the East Coast of the United States. We know that COVID is planet-wide. It's hitting hardest in the United States right now, but the rest of the Americas are in line for the same disease hitting. And Marco, can you just take a moment and tell us how people can share this on Facebook right now?
Yes, Ted, thank you. And thank you very much to all the panelists for being here. We usually take a minute to ask you to go on Facebook and share the link for this. We are still not on Facebook, so we're gonna run the video, the interview as the Facebook starts streaming. And so let's go listen to the interview that we have ready to start.
Good evening. This is Ted Lewis coming to you tonight from Global Exchange. We're pre-recording interview with Dr. Ken Patterson. This is part of our presentation tonight on Pan-American unity versus COVID-19. We're going to be speaking with people in Colombia, Ecuador, Brazil, El Salvador, Mexico, and the United States tonight. And Ken, who is a physician who's been on the front lines of this from the start in Western Massachusetts, has agreed to speak with us. At the time that this interview will be playing, Ken will be back at work in the emergency room. Ken, we've been friends for a long time, and I know this is a difficult situation that you're confronting in your community. Can you tell us, I know we talked a couple of weeks ago and things were just getting started. Can you tell us what you're seeing in places like Pittsfield, Massachusetts, and North Adams, where you've been working and will be working again tomorrow?
Well, one of the most remarkable things about the last couple of weeks has been an overall reduction in volume in the emergency room. Ironically, fewer people are coming in out of justifiable fear, I think, of contracting the virus in the emergency room. But just in the last week, we've had a ramping up of more sick people, many more COVID positive patients. And the last time I worked on Sunday, my first 3 patients on the shift were, 2 of them have turned out to be COVID positive, and they all 3 arrived by ambulance in respiratory distress. And so I'll go back to the emergency room tomorrow, and I'm aware that it's really ramping up now. There's a lot of fear. I'm afraid some people aren't coming in to get emergency services that could really use them. And of course, there are always a few people coming in who are worried well and are demanding to be tested.
And in terms of that,
But I expect, well,
sorry, we're having a little bit of a slowdown here. What is the availability of testing there now? Has that situation improved? I know when we last talked, it was very difficult for someone to get a test.
no, it's miserable. The only people that get a test at our hospital are the ones that are admitted and are then ruled out. We first do a panel of respiratory pathogens, including influenza A and B. If all of those are negative, then they are given a test, and that's still being done by the state health lab and taking a few days turnaround time. We still don't have easy testing availability. People can go to a tent that's adjacent to the hospital and be tested if they have symptoms or if they've been in contact with patients. But we have miserably few tests, and that has really crippled the response, I'm afraid.
Ken, thank you. For those of you who are watching, this is a pre-recorded segment of our webcast on Pan American Unity versus COVID-19, a view from around the Western Hemisphere. We're talking with Ken Patterson, a physician in Western Massachusetts. Ken, tell us, what do you think are the things that, there's been a lot of discussion about the question you've just brought up, that of the tests that haven't been available, haven't been at the disposal of health professionals like you. What needs to happen? What are the demands people should be putting on the government here? And what are the lessons that people in Latin America, who is facing a growing crisis around COVID-19, what are the lessons they should learn from our mistakes?
Well, if you have the capability, you need to start testing now, and you need to do it smartly with epidemiological methodology. Clusters of people need to be identified who are positive, and measures need to be taken to isolate them. I still don't have an understanding of why we have been so unable to do early testing. I don't know how Korea and China was able to ramp up testing so rapidly, and we find that impossible. But I did read an article today that was reporting on a connection that Jared Kushner has to a testing company that was trying to develop a format for testing. And it appears that funding for other testing companies wasn't even explored while they were trying to get that up and running. I don't know that that'll turn out to be substantiated.
Well, that's certainly shocking. Ken, we're going to be speaking with people tonight from Colombia, Ecuador, Brazil, El Salvador, Mexico, the US, and Canada. And we really appreciate that you've been able to come in from your home in Western Massachusetts and share all of this with us. We're wishing you good health and wish that you could be on the program live with the rest of us. And I will get back in touch with you. I love you, buddy, and I wish you the very best out there. Thank you so much for working and sticking up for all of us. Thank you very much to all the panelists who've come tonight. We just heard from Ken Patterson in Western Massachusetts, and now we're going to go to the Northwest and speak with Barb Netterpal, who is the president of the Hospital Employees Union of British Columbia, a very large Canadian province. Her union represents more than 50,000 members working in acute care hospitals, residential care facilities, community group homes, outpatient clinics and medical labs, community social services, and First Nations health agencies that provide direct and non-direct care services. Barb, thank you so much for being with us tonight. By the description of your job, we know that you are a very busy, busy person right now. We also know that Canada is one of only 3 countries in the Western Hemisphere, the other 2 being Costa Rica and Cuba, that guarantees healthcare as a right to all of its citizens. Can you tell us a little bit about what's happening in your part of Canada, and how you think that being a country with a guarantee of public health might change the game?
Yeah, thanks so much for that. I'd just like to acknowledge that I am coming to you from the traditional territories of the Secwepemc Indigenous peoples. Very honored to be here. And before I get into the benefits of being in a universal healthcare plan here in Canada, I just want to acknowledge before I even start that these are early days. We know that a surge is coming, but right now, at least here in British Columbia, we're starting to actually flatten that curve a bit. We have now more people recovered than we do sick. Hospitalization rates are low, very slow trajectory. But I don't want to understate that this situation here is still very, very volatile, and other provinces in Canada are facing some more challenging times. So I just want to be cognizant of that as we go ahead. Because we are doing some things right. It was good to hear from Dr. Patterson, and I can kind of contrast our worlds a little bit, particularly in 2 different ways. So first of all, I got to say, we're so different from the US because Canada, right from the beginning, has a strong and comprehensive emergency plan that kicked in right away and then ramped up. So we were prepared, nobody was prepared for a pandemic of this magnitude, but we were more prepared than the United States was. And that got rolling really quickly. So the social and physical, or rather the physical distancing was put into place and escalated really early. 14-day isolation for travelers, or if you were sick, happened quickly. And we needed people to stay home. So to do that, our provincial and federal governments worked to include in their plan like a national economic package. So that would financially support individuals and families and businesses, so that anyone that worked in the non-essential services could stay home and stay safe. And that's been supplemented here in the province of BC as well. So here they're working hard to ensure that childcare is available for the essential workers. Right now, workers cannot be fired because of COVID. Renters cannot be evicted because of COVID. Rent relief is being provided to those who need it. There's additional money being added on top of the federal funds for those who can't work due to COVID. There's also increased financial supports for those on social assistance or other government programs. People with disabilities, they're getting additional financial supports. So not only is this good social policy, but what it's going to do is actually it's going to make for a faster economic recovery for people and businesses when that day comes. And also this plan includes a coordination and collaboration that you didn't see in the United States with regards to our provinces around procurement and distribution of medical supplies. So this is a huge, worldwide concern. Certainly for us, as a union that represents members on the front lines, safety protections is, the most important protection that we will advocate for. So, for example, one of the things that the government has done is they've ordered thousands or hundreds of thousands of face shields from a company called Bauer, which is a hockey equipment manufacturer. And so they're making face masks for healthcare workers. I mean, that's a made in Canada solution. The auto industry is building ventilators, and anybody with a 3D printer is chipping in and making masks and other items. And these donations are going into a central system to be vetted and then distributed to the provinces where they're needed. But the other major contrast, which you talked about in the beginning, was the fact that Canada has a universal public healthcare system. Now, because everyone here has the ability to access free healthcare, that means that people can have their medical needs attended to quickly with no fear of huge medical bills or bankruptcy. So people that are experiencing symptoms of COVID, they can easily access medical advice by phone with a nurse or by video conferencing with a doctor to determine if they need to stay home when their symptoms are mild. They're told to self-isolate and monitor their symptoms. And when their symptoms are greater or as it progresses, they're told when to go to the emergency room. Testing here is free and accessible. However, we do have, one of the highest testing rates in the world. But here in BC, it's very focused on who we're testing, and it's done on a priority basis, starting with the sickest, the most vulnerable, like seniors that are in long-term care, where there's clusters, and of course, healthcare workers who have a higher level of exposure and a greater risk of transmitting. So testing is done by appointment. So you're told when and where to go. And to ensure physical distancing, just like Dr. Patterson said, tents are set up outside hospitals, but also in other areas like public parks and that sort of thing. And people just actually drive through and they can get tested. They don't even have to leave their car. So we're starting now to monitor healthcare workers for symptoms up to twice a day. So that includes temperature and checking for other symptoms. If they do have COVID symptoms, they are sent home to self-isolate. And because they're mostly unionized workers, they have access to sick time benefits. So again, there's no financial gain or risk for people to stay at home, or they don't need to risk going to work sick and spreading this virus. So here we've also canceled all elective surgeries and discharged and moved patients out of hospitals as much as possible. That frees up space for COVID patients if and when needed. Isolation precautions are very aggressively enforced in long-term care facilities, where even a single case has been reported. Admitted patients are put on ventilators earlier because that's been shown to improve outcomes and decrease recovering times. And also, one of the things that we're doing here in BC is modeling. And by we, I mean the public health officer has done this modeling, and it's shown that we will have enough ventilators with what we have, what we've ordered, and what is currently being refurbished quite comfortably if the current trajectory continues. But if we do actually start to hit the rates of, say, like Italy, with some creativity and planning, that the healthcare system here will be sustained. So we're doing a lot of things right, but this is not to say that things are running smoothly or that changes are happening quickly enough, or that there's not going to be gaps or mistakes made, because that certainly we know that that's going to happen. And we do have some weaknesses within our public healthcare system that are impeding our response, particularly here in BC. So even within a public healthcare system, we have private, publicly funded, but for-profit companies that deliver some of those services. And that means that these companies, they need to operate with a profit margin. And that's largely done at the expense of workers. So that means lower wages, lower benefits. So workers need to work 2 or 3 or even more jobs sometimes just to make ends meet. So why is that a problem? It's, because one of the most important things that you need to do to prevent the spread of COVID is to prevent workers from possibly spreading it to the other facilities. So the public health officer has been working really hard to limit workers to just one facility. So workers would have to choose, and they're probably going to choose the one that pays the best, which potentially will now leave another facility without staff. So potentially thousands of hours of frontline care could be lost. As well, the income of these workers could be dramatically reduced. And another issue is that the vast number of employers, some even within a single facility, are very inconsistent with their direction to workers around personal protection equipment that they're supposed to use. So the use or the burn rate of the use is really, really high at times. And so going through this precious resource way too fast. So now that the brakes have been slammed on and they're being rationed, there's a lot of confusion and anxiety for workers that are already under a great deal of pressure. So the government and the public health office are working really hard to overcome, but this has been a monumental challenge.
Barb, thank you so very much. That's it's incredible to hear the level of coordination and all the good part of that. We're going to go next to Marco Castillo, who's in New York City, where things are very much not going the other way. And just after Dr. Patterson got done recording, when I was speaking to him, he came off the phone and was very upset because the numbers that they have projected in Massachusetts, so that they're going to run out of ventilators during the projected peak of the disease, and it's going to put him as a frontline doctor in a horrible position. So thank goodness you've done such a good job there, and I hope that can continue. Marco, you have been in New York City, but you've spent much of your life working with the immigrant community. You yourself are an immigrant to the United States. Please tell us what are the special ways that this epidemic, this pandemic is impacting the immigrant community, and very quickly, what's the campaign that we are working on to try to help in ways that we can?
Sure, Ted. Thank you very much. Unfortunately, on this part of the world, the reality is very different from what Barb just presented to us. We are in ground zero on what is the epicenter of the COVID-19 epidemic. As of today here in New York, we have 25,590 cases, and 4 hours later was reported that there's 537 people who have passed away, unfortunately, as a result of a crisis, a public health crisis that every day it's more and more clear that could have been prevented, that could have been planned better. And now we are in the middle of this hell, please allow me to call it like this, where people are not really are feeling helpless. We are reaching numbers that are gonna fill up current capacity at hospitals, and FEMA and the Army are building hospitals, Javits Center and other places in northern New York. And also we got a hospital ship from the Army, and it still is not enough and won't be enough. It's estimated that we're probably gonna need up to 110 beds, and right now current capacity it's 25,000. So it's a very uncertain future. And yes, from my working experience, immigrant communities, particularly those with no recognition of immigration status, and those who are indigenous are facing the hardest conditions. They find themselves in this crisis after an administration that has repeatedly pushed them away from the system, scared them away from reaching out to doctors and to hospitals, and now Dr. Fauci and the government is trying to say, please come take care of yourself, come to the hospital, when in reality, people are absolutely scared of the consequences of this. So people are preferring to stay at home. It was reported today that emergency rooms were not as filled up as they were expecting, which doesn't mean that people are not dying. It just means that people are scared of showing up at hospitals, scared of getting infected. It's been also documented that they don't have enough sufficient equipment. And doctors are starting to die. A personnel at the emergency room passed away, one woman yesterday. And so it's a very sad reality, a cruel reality, that it's also a consequence of a city that has dismantled their health institutions and infrastructure for the past decade, turning hospitals into luxury apartments and luxury buildings. And so now this is the consequences that we're seeing. The future is uncertain. Certainly we're going to see a crisis, an economic crisis coming, and a food crisis coming in the following weeks. But to not sound that pessimistic, I also want to say that this crisis is also the opportunity for many communities to come together and reflect what is the New York, what's the city, and what's the world that we want to see after this. And we certainly know now that we want a world that invests more in hospitals and less in malls. And that's the opportunity that is in front of your eyes right now. And local solidarity and collaboration between neighbors, it's blossoming, and hope that it continues. Thank you.
Thank you, Marco. And can you put into the chat here the campaign that you're working on to
Absolutely, yes. So
migrants for detention?
Together with a group of organizations from Mexico and the US, including New Century Movement, Alianza Americas, ourselves, Global Exchange, we are calling on governments on both Mexico and the US to immediately close detention centers and release all migrant families and currently in detention right now. This is a moment where we should keep ourselves and stay safe, but this is not a moment to forget about others. And those who are in detention centers right now that have not committed any kind of crime, that there was no reason for them to be in detention. Now there's even more reasons to release and free them. So it's a call that we're making, and we invite everyone who's watching us here on Zoom and on Facebook to go ahead and sign this letter and join us in this effort.
Yeah, thank you very much for that, Marco. And that's an issue that goes to both sides of the border, isn't it? It's in the United States and it's in Mexico as well. We'd like to go next to Mexico. Laura Carlson is in Mexico City. Laura, you've been on many of these programs with us over the years, and this is a very new challenge. We know that Mexico has been criticized for its response. We'd like to get your perspective on how that is working in Mexico, and also if you can speak, please, to the particular burden that this health crisis is placing on women, both in Mexico and in the wide networks that you have with women around the hemisphere.
Sure, Ted. Thanks a lot for organizing this and for the opportunity to join everyone here. There's been a very consistent message in the US mainstream press and internationally in general regarding the Mexican government strategy, which is that the Mexican president ignored it, that he was nonchalant about it, and didn't take the illness, the virus seriously until just very recently. That's not exactly the case. What happened in Mexico is that the Mexican government made a decision to keep economic processes, basically to keep people out without distancing for as long as they possibly could. We won't know if this was the right decision or not for a couple of weeks, because Mexico is behind the curve of the United States and Europe in terms of contagion, and also because there's very little testing done. Again, that's a result of two things. One, to maximize resources on preventing deaths. They just didn't have the access to the resources to testing, and then basically the access, and then also just saying that they wanted to focus. They didn't see the value. They weren't going with the strategy that relied on massive testing, which wasn't actually an option, a viable option anyway. So right now we're just beginning to see here in Mexico the early part of the contagion. We've gone from stage 1, which was all pretty much reported cases that were hospitalized and confirmed, imported, that is to say people who had gotten a coronavirus in other places, and now we're seeing, of course, a local transmission. And they do anticipate that we'll get to a 3rd stage, which is pretty massive epidemic stage. There's almost no way that people think that that will be avoided. So the president has been, it's not a surprise that he's been seen as trivializing what the coronavirus here in Mexico, because of showing, amulets and religious talismans as his protection against it, instead of following his own team's advice, for social distancing. Now, however, we are in a stage of what they call sanitary emergency. People are social distancing. There are restrictions, but they're all voluntary. And again, that's a decision of the Mexican government to avoid what they consider authoritarian measures and rely on communication. Unfortunately, the communication, while being very transparent, there have been press conferences every day, has been mixed messages because of the president's own behavior and attitude. But essentially what's happening is it's a country where there are 52 million poor people and another millions who are kind of teetering on the edge of poverty. And it's very easy for a major economic recession to push those people creating a situation in which there could conceivably be more deaths from hunger than there would be from coronavirus. That's why they've had this kind of surgical strategy to try to pinpoint the exact time when they said, okay, yeah, now everybody go to their homes. And that's of course now, and it's going to last at least until the end of April. So we're in basically the same situation. As far as confirmed cases, there's 1,378, and nobody should even pay any attention to that figure because there's so little testing. As far as the dead, there are 37, and that figure should be relatively more precise. The economic situation that they're expecting is kind of a perfect storm for Mexico, with oil down to $10 a barrel. And they're predicting a 3.9% drop in the economy recession. The president believes optimistically that it won't be that much, but his own team is actually predicting that. And that, as I say, is drastic for a country as poor as Mexico is. They've tried to avoid the authoritarian measures, which is a good point in favor of what's happening here. But there has been a massive transfer of civilian functions, particularly hospitals and hospital equipment, in the context of the coronavirus to the armed forces, which has many of us concerned, because with the drug war, the armed forces began to work in public safety, and now we see an expansion of their role. And what we know from history is that once that happens, these authoritarian measures or militarization or both, it's very difficult to roll back. On the point of women, to finish up, what we've been seeing is what we see everywhere. Women in Mexico, they brought out some statistics, do at least four times as much care work, about 40 hours a week, as men do. The children are out of school. Women are taking care of the elderly. They're asking anybody with coronavirus who's not in a high-risk group to stay home. So they're also taking care of the sick, and they're taking care of in many cases as caregivers for other families as well, domestic workers, sex workers, caring for the elderly in some of the lowest paid jobs there are. There don't seem to be so far, we get the economic proposal on Sunday, but there don't seem to be so far payments to women in compensation for this work or a strong gender focus on what needs to be looked at in terms of women's role. The other concern with women, and the government has acknowledged this, but again, the measures proposed are very weak, is a concern that's happening throughout the world, that when women are confined to the home, there will be an increase in domestic violence. You can see from the marches, from the record mobilization of women on March 8th here in Mexico, that domestic violence and all kinds of violence against women has become a major issue here, and women are at a breaking point in terms of the anger and the direness of the situation, the femicides that they're facing. So they've offered a 911, which is basically services that already existed, while shelters across the country are underfunded. In fact, they're in a kind of a funding limbo because of the new government, and there's no additional service being asked for. So we're also asking that. And to finish up, the issue of immigration is, of course, very important here as well. We've got a crisis on the southern border, a crisis in the northern border, and a more invisible crisis throughout the country. On the southern border, we just had the death of a Guatemalan man after a riot broke out among prisoners who felt they were sitting ducks in a detention center, as well they are. And the authorities did not let people out after a fire started. And so several people are hospitalized, and there's now another big attempt to free people who are in detention centers, to stop migrant arrests, and to guarantee safe return. Central American countries have closed their borders. The United States is sending people back and has basically shut down all asylum seeking processes for now. So again, there's a pressure cooker situation in terms of migrants happening in Mexico, with pressure from both sides, and a government that has been attempting to stick to a Trump dictated line of cracking down on migrants, but at the same time reaching a completely untenable and very dangerous situation.
Laura, those are topics that we're going to have to come back to. Super important what you're bringing up. One more reason to sign the petition that's in the chat here. People need to be released from detention facilities. This is a crisis. We're going to skip now, change our lineup just a little bit, and skip to Natalia Green in Quito, Ecuador. Natalia is the president of the Coordinating Entity of Environmental Organizations of Ecuador, and she's going to reflect on Ecuador's strong response to COVID-19 and reflect as well on how indigenous communities in the Amazon are coping, responding, and continuing to mobilize to protect their lands and nations in the face of the outbreak of COVID-19. Natalia, thank you so much for taking time to be with us tonight.
Hi, Ted. Thank you so much for the opportunity to participate in such a beautiful panel. I was listening to all the panelists and with a healthy envy, listening to Barb, especially because of the situation that we're facing, especially in Latin American countries. First of all, I want to share with you guys what's our sanitary emergency situation. We're all at home, no school for the kids, everything is closed, only pharmacies and markets are open. We have a very strict curfew, like the curfew starts at 2 p.m. until 5 a.m. So it's a very strict curfew. There's no inter-province or international travel, so that has been all suspended. People who have a car, for example, my car, I can only drive it twice a week, and I can only enter markets 1 day a week according to my ID. So as you see, we have a lot of restrictions for mobilization and a big campaign of stay at home. However, the curve, of course, is growing. We are a very poor country as Ecuador. In total, we only have 3,163 cases. And you have to see Ecuador in two ways. we have 71% of the cases only in one province, in Guayas. The largest city of Ecuador is in Guayaquil, and 2,243 people are infected in Guayaquil. So the curve there is crazy. What's going on in Guayaquil is a situation that is completely out of control, especially because it's a situation where people live in very poor conditions. Like some of the people that are staying at home say, you know, it's not a situation where people can stay at home. The homes are not like adequate for people to live in there. And you know, the situation in Guayaquil is out of control. There's cadavers that cannot be picked up from the streets. You know, it's a situation that cannot be handled. On the other side, like where I live in Pichincha, there are only 259 cases. And in the Amazon in general, there are only 48 cases. So what is happening with the Amazon is quite interesting, because not only in the Amazon, but also in communities here in the highlands, is that they have all decided to have like a community lockdown. So no one in, no one out, which means it's a very interesting phenomenon, because people in the city are starting to realize that, yes, we depend on agriculture and we depend on people from communities bringing us a healthy food. And they have decided completely to do a lockdown, in, no one out, to avoid infection. So that's quite interesting, and that's what is happening in most of the communities in the Amazon. However, as you guys know, we have non-contacted indigenous people in the Amazon, which is, of course, we are always trying to protect them. But can you imagine if one case goes into their territory? It's pretty much like the extinction of that whole group of people, because indigenous people in general that have not been that don't have much contact with urban areas have a less defense than people that are living in the cities. Imagine what can happen with people that are non-contacted. If an oil worker, for example, goes close to a community of like non-contacted people and they get the virus, it's pretty much the extinction of the whole group of people, which is a tragedy. And that's why what is being to be avoided in these situations. And of course, unfortunately, indigenous communities do have their own food and have like food sovereignty, so they can survive, you know, like for a period of time with their own food system. However, they are dependent in food like flour or rice and other things from like the outside world. And we are trying to coordinate how that like stocking up of those that food is going to happen, because that needs to be carefully taken care of. There is a situation as well that needs to be taken in consideration, that many people, when these restrictions started, were, for example, living or were at the city, and now the community is in lockdown and they're trying to get in the community. This is, of course, a danger, and they're trying to get in secretly. And there's a whole like conflict over there, because if they go in, they can bring the virus, but they cannot stay in the city because they don't have a way to sustain themselves in the city. So there are all these contradictions that we're living with the Amazon people, and we are trying to support them, bring them like sanitary protection. So if there is going to be some contact, that they have all the like the masks and the alcohol and all the sanitary protection that they can have. But of course, as you can imagine, we do have very little testing in Ecuador. We think that the cases that are actually happening are double of what we learn from the news. That we know that in the Amazon is maybe not 48, but even more. And if this gets into indigenous communities, it can be definitely a disaster. Just an important data is that 45% of Ecuadorians live in inadequate housing conditions. That is 1.4 million people living in inadequate housing conditions. And I hear what Laura was saying. We are getting reports absolutely every day of the raising of domestic violence, both to women and to children, which is something that really worries us. And there are many organizations that are trying to see how to prevent this situation, because that's a situation that is definitely getting out of control. On top of that, we have had very bad rain in the Amazon lately, and there are some communities like Sarayaco that has been suffering of flooding. So of course, very little aid can go to those communities because they want to keep in lockdown, but very little aid can go to those communities that are suffering now due to flooding as well. Um, so yes, we have a situation with with housing with no or very basic services, and the campaign of stay at home is not as easy for everybody to follow. So this is a situation that needs to be considered, because when you are asking a house where, you know, a house with two rooms where 15 people live, to stay at home is quite a different situation than in other places, and that's why people are going out and then getting contagious, and our health system is not prepared for this. So I think that the big restrictions that we have in Ecuador is pretty much to try to avoid a health system that is definitely already is already out of control. We don't have enough beds. We don't have enough respiratory aid for all the people that are contagious. So that is why the restrictions are so harsh. In spite of that, the cases keep on growing. If it wasn't for Guayaquil, we'll be for Guayas, we'll be in quite a good situation, because as I was saying, the provinces of the highlands and the Amazon are in a better condition because the cases, at least what we know, are not so high, but the condition in the coast is really chaotic. That is why in some countries they are already talking about Ecuador as a really bad model of responding to the sanitary emergency that we're living in the world. I just want to end with a note that I work with the Global Alliance for the Rights of Nature, and what we are doing in general, and I think that is something that is happening all over the world, is pretty much defining and understanding what is our role, what Marco was saying, what happened when this is over, and what is the message that nature is trying to give us. I think that is very important to understand what is our role as a society in this world that is going to come up, and that is going to come after the crisis. Thank you very much.
Yeah, Natalia, thank you so much. And that's a great note to end on, because there is all the struggles that we need to take up and intensify when this is over. We're going to move to the other side of the Amazon now, to Natalia del Campos, who's in Sao Paulo, Brazil. Natalia lives in New York City, but is in Brazil working with the Defend Democracy in Brazil Committee. Natalia, you've arrived in Brazil at a what must be a very strange time. Can you tell us what you're hearing from the popular organizations that you work with and on the street, and what is the feeling that people are having toward the president of Brazil we've been reading a lot about that. Can you give us the view from down there, please?
Sure. Hi, everyone. Thanks for inviting me. So as Ted mentioned, I'm from the Defend Democracy in Brazil Committee, which is a group of citizens from different professions that got together 4 years ago in New York to fight for democracy when the president-elect was removed. So since then, I think Brazil has been in very complicated strains of, you know, political fights that I think are very connected to what's happening now in terms of the pandemic and how that's being reflected in the care or lack of care to the Brazilian people. And so in terms of that, you know, all the crises that happened over 4 years that led to the election of Jair Bolsonaro, of course, had a lot of impact on the social movements that we are connected with and that we defend and try to help denounce in the United States and around the world, in connection with also collectives in Europe that fight for democracy, mostly Brazilian collectives around the world that are also connected to try to restore democracy. So one of the things that we have been supporting a lot of the movements that are at the base of society that have been, you know, sort of forgotten by the governments that have advanced a lot of neoliberal policies, taking a lot of funding out of health systems, education, and so on. So there are a lot of efforts. So first I'll talk about the situation, and I think you've been following in the news, but the things are getting worse by the day, right? We're at almost 8,000 cases these are the official numbers. And I think, honestly, in touch with movements and in touch with poorest communities in the cities and outside of the cities, I think the numbers are much higher. Just like there's a lot of sub-notification. There's also a lot of very little testing, as we know. But the official numbers of today are almost 8,000 cases, 50, and then 299 deaths. Majority of these are in São Paulo, where I am. I am from São Paulo, actually. I had this trip planned for a project and also to visit family a long time ago. And then the day I left was pretty much the last normal, more or less, day in New York. So the group is still there and things have ramped up there and here. And then 3 days after shelter in place was instituted in New York, it was also instituted in São Paulo. So the state government in São Paulo at first was very rapid in responding and following sort of protocols of the World Health Organization and other leaders around the world to sort of try to institute shelter in place, not exactly just like first close down commerce and then institute essential services, but it's not directly followed as it is more, I think, in the US and other places. A lot of activities that are supposed to be stopped are still going on. Around where I am, there's a lot of civil construction still happening, but it's not essential. So workers have to go to work and they have to, of course, ride on buses. The day I arrived was the 13th of March, and we took bus and train from the station wearing masks, but we were, of course, the only ones, me and my husband. And then it was like jam-packed buses and trains, and I could only see how this was going to spread very quickly. And it's been, in a way, a little less rapid than I expected, because the governor of the state has been very confrontational with the federal government and has been putting things in place to contain that are much, much harsher than other places in Brazil. But the state governments of the most populous states like São Paulo and Rio and Minas Gerais have been much more strict on these regards. So there has been some effect on the curve, I think, but the curve in São Paulo is really ramping up very quickly. So as you might have seen this week, Bolsonaro is still denying as a little flu. He's denying that the COVID-19 could be anything other than affecting just a few people. And of course, they've been, so I mean, it's politically, not only he's isolated politically now, so there's a crisis, and therefore the Congress has passed some relief to the most needy population, but this hasn't yet been signed by Bolsonaro, and he hasn't yet released the funds, of course. And his Minister of Finances, both of them have been really working towards what we call the necropolitics, politics of decimating the most vulnerable populations, especially Black communities, the indigenous populations. They now have also been creating all these hardships to actually distribute the money, which is in dollars, is like 120 US dollars, 600 reais for a period of 3 months of relief. And this is for people who really do not have anything to eat. So in terms of politics and what to expect the state, it's been terrible and it's been horrible, and every day it's getting worse. And the state governors wrote a letter, 27 state governors wrote a letter against the politics of the federal government. And so they've been stepping up against him, and that's a good sign, and they need the popular support, which has been very slow in coming in terms of feeling that they should continue on that path. But in terms of that, I think the population, because of the political path I sort of described earlier of this past few years, and now the population really knows already that they cannot count on the government. And so several social movements have been stepping up to do essential services that the government is not providing. We have been connected with UNIAFRO specifically, and I'll post the link so people can share. And UNIAFRO started a campaign in Brazil to, a crowdfunding campaign to do the most basic equipment or cleaning supplies or basic food, non-perishable foods to communities known as favelas, right? They work with 31 favelas in Rio and Sao Paulo. So we engaged immediately in that campaign. And then we helped them to engage with another network we're part of in the US called US Network for Democracy in Brazil, which is composed of 1,500 members. A lot of them are university connected, either professors or department heads, and also activists, like us, who are not necessarily from the academic world, but are very connected and working together with NGOs, with the academics that are especially Brazilianists, as we call people who are specialized in Brazilian history or Brazil, and have put together from the next day that Bolsonaro was elected, this network has been working together for a year and a half now. So the US network helped with us to sort of translate that campaign. And so the campaign, I'll post the link here now, and it's been now translated so people can donate without being a Brazilian citizen. Before, you had to have a social security, basically, that was Brazilian. But if you go to that site that I just posted, the first one is our website, just so you know a little bit more about what we do and campaigns we engage in with the social movements here. The second one is this campaign in particular. So UNIAFRO works specifically with Black Brazilians in the poorest neighborhoods. The other campaigns that we're engaged in are with the MST, which is the Landless Rural Workers Movement, which is one of the largest social movements in Brazil that connects people who have no land to reuse and try to distribute and do the agrarian reform in Brazil. And they have been bringing, food to the tables of millions outside the agro business, which is the destroyer of the Amazon and other areas. So the MST, as we call the Landless Workers Movement, they do a lot of distribution of food to not only to their members, but to the local communities where they have land or where they are acting. They're also talking about engaging with other movements such as union leaders and other social movements that are workers' movements to try and get to communities that have no access to government support or will have very little that won't really make a difference. And then there's a lot of several other initiatives that are really people-led, and in the communities, or the favelas as we call, they all organize around associations like neighborhood associations and sort of do the crowdfunding and the sort of food gathering for people who donate goods to distribute. There've also been some crowdfunding that I've seen today of people really raising money to build, to hire women who do sewing and that are out of jobs now, to sew masks and donate to healthcare professionals, as well as the people who have absolutely no access to, especially the disposable ones. So they have been doing fabric masks so people can reuse them and wash them and so on. The women's movements have been very instrumental also in bringing awareness against the femicide or the violence against women that has ramped up since the quarantine started in the big cities. And so that's been important. It's also always, people-led, because also the Minister of Women, and which was destroyed under Bolsonaro, and now it's called the Ministry of Family or something. I can't remember the full name, I'm sorry. But they have also been overlooking the violence, and evangelical churches and commerce, specifically agribusiness, have been really pressing Bolsonaro to keep keep the commerce open and keep the church services happening, and that's really having an effect. First, like I said, the governors were really pushing and getting the message across on how important it was to be shelter in place. And then Bolsonaro did a very complicated pronouncement to the nation, and that made workers, as I've been speaking to workers directly, and they've been very confused. What is the real message that they should be getting? Is it to stay at home? Is it to go back to work? But we must, keep Brazil going, and so on. So much so that I think the mayor of Milan apologized, right, for the number of deaths they had there, and that he wanted to keep the city open and see how much that was sort of reflected upon Bolsonaro's speech and how much he didn't want to see the same happen here.
Thank you.
But
Thank you, Natalia.
oh, sorry, just
No, it's okay. We need to wrap. Hearing everything that you're telling us makes me want to be sure to get back and have another webinar where we give you and your colleagues more of a chance to tell us about all the aspects of what's going on in Brazil. We wish we could do it more right now. We're already at 5 o'clock and we have 2 speakers left. So we're going to extend with apologies to everyone. I don't really feel like I've been a bad moderator because everyone has had so much interesting things to say. Alejandro Castillejos, you are in Colombia. You're a professor of anthropology at the University of the Andes. You have been closely and intimately involved in Colombia's peace process. And can you talk to us? You just wrote an article about the multiple devastations that have hit Colombia. Can you please tell us what's going on in Colombia and how you see this affecting the peace processes and the work to end the war in Colombia that means so much to a lot of us?
Thank you, Ted. I'm just listening what the other colleagues are saying, from Ecuador, from Mexico, from Brazil, and in some ways what I'm going to say is basically somehow repetition, but I'll try to make an argument, a very short argument about devastation here. In general, Colombia is going under pretty much the same circumstances. In a way, there is very little testing. There is a political confrontation between the mayor of Bogota, for example, and the president as it regards to how to deal with the pandemic in general. Colombia has, as far as official numbers are concerned, 1,200 people infected. And Bogota is the major, say, like almost half of that people is located in Bogota. There is a big conversation about the lack of hospital equipment. The airport is still, by the way, is still open. There was a large debate as to what extent should be open, and it's been really, coming in a lot of flights from Europe, flights from Spain, flights from the US, and there has been a very strong debate about it. There has been some measures in regard to financial assistance to vulnerable people in general, and but that has also been very limited. In some cases, the government, the state government has taken the funds from the local governments in order to do something much more national, but has in some way left the local measures sort of halfway through. There is also, as we are right now in a formal quarantine right now, mandatory quarantine. Of course, as other cities in Latin America, what is left in the streets are basically homeless people without houses. And in Colombia particularly, there is a lot of a large Venezuelan immigration in Bogota that has, in this case, as people is getting into their homes, it has grown in numbers, and it has become even much more visible than has been so far. So there are a lot of movement restrictions. There is the pace of slowing down. The curve has been very slow. Some people say that in general, the testing process has been very slow, and therefore the numbers are really under numbered in general. So in regards to the question, I just want to place this question to the other colleagues, to be honest. And I say this is the question of devastation. As I was looking into the news for the last 2 weeks, and as is the case in this panel, our conversation is really about COVID, about the virus, about the context and the consequence of the virus. But then I started to think, what is really violence in Colombia? In some ways, my sense is that violence is not only about COVID, it's not only about the violence against the body in relation to the virus in general, but also another, many other kinds of things that have been happening. For example, over the last 2 years, 600 and something social leaders have been killed. That has been part of the peace process, a consequence somehow of the current political establishment that has led the peace process simply aside, underfunded, and so on. And so one of the consequences of that is the assassination of people, the assassination of, for example, land restitution people, the assassination of illegal crop substitutions, well, the assassination of ex-combatants. 180 something ex-combatants have been killed in the last year and a half or 2 years. The assassination of peace activists, human rights activists, and so on. So here is one question. Are we dealing, when it comes to COVID-19, are we dealing only with the COVID-19 consequences, or should we also include the other things that come around the COVID-19 or that are part of the context, in particular in Colombia? So my sense is that on the one hand, we have devastation of body mistreatment in general. And on the other hand, we also have many different kinds of structural forms of violence that are continued here, even after the peace process, not to speak about the consequences of the COVID restrictions in regards to the ex-combatants. But also I wanted just to say that there are also, as my colleagues have stated, that there are other conditions, what we would call structural violence. I was wondering to what extent can we say that the health system, for example, is part of the devastation? To what extent, for example, the contamination of the rainforest and the lumberjacking in the Amazon here in Colombia, as well as in Brazil, as well as in Ecuador, is also part of the devastation in the whole continent. So my question really is not only about COVID, it's about really what are the traces of many forms of devastation in which COVID is only one chapter among many other. I recall right now the wildfires that we have had in Colombia for the last months, as well as in other places. Just remember what happened a few months ago in Brazil, the agribusiness at the same time, which is based on the destruction of the rainforest. So in general, my sense is that we are sort of like an archaeological sort of how do you say that? Yeah, like an archaeological piece in which we are putting together forms of devastation on top of the other. And in what we are looking at is actually the cross-cutting of all these kinds of violence in this particular country. And then, my question is, shouldn't this be a question of the continent in the end? Shouldn't this be something that we should think about across the board in the continent? As we intersect many ways, many forms of violence, and produce, of course, many kinds of victims. Let me just only say that, plus on top of that, we have 8 million victims of violence officially confirmed and officially in the record, 8 million. So the consequence of not having a universal health system, but a private one, and all the complexities around that also influences, also shocks millions of people that have also been, literally on the streets and are part of larger, very large populations of vulnerable colleagues, vulnerable citizens as a consequence of war. So, this is only what I wanted to say, that, to what extent are we really meeting multiple devastations? That's my question. I just leave it at that.
Alejandro, thank you for those commentaries. There is a lot of food for thought in that, and I think you really brought a lot of the themes that have come up today together. I want to go on and give John Giuliano a chance to let us know what's going on in his community. John is the executive director of the Tamarindo Foundation, which runs a youth and community center in Chalatenango province in El Salvador. And John, when I talked to you before, it gave me some real hope to hear how your community had responded. It was what seemed like an example of the grassroots moving a lot faster than the federal government. Can you tell us what's going on now and how you're seeing things? We need to unmute you, John.
There we go. Okay. Yeah?
Perfect.
Okay, first of all, thank you. I think our situation is very, very different and and certainly we're certainly beginning to begin that curve. And I think one of the things that El Salvador saw was the models in Europe. I mean, and we took those very seriously. El Salvador, a very small country, we're the smallest representative here tonight, little tiny country, no? Very vulnerable country. So the virus would be completely devastating us. We're looking at those numbers economically and the number of deaths. So beginning with the country, the president of the country, Nayib Bukele, saw that and immediately took action. And he was supported pretty much by the whole country. Restrictions, everyone stay home, economic packages to support people, and people responded. And here in the communities, we saw that also. We were watching this thing happen, and we also have an experience of war. You know, we lived isolated for 12 years. You know, we were completely shut off from another world. So we began organizing the youth. And the big thing was, one, know what the hell the virus is, really educate, you know, so people were aware. And I think our biggest problem here has been disinformation, right? Like everywhere. Every day, you know, social media creating circumstances and things just aren't true. So I think the youth have been a great source of education for the community. We also taught people very basic things, you know, what social distancing would mean, even how to wash hands, which I didn't really know how to do very well. They taught me, and pretty much, you know, we were prepared with food, our water, and right now we have 41 cases in El Salvador. We have 2 deaths, and certainly that will change. We're also in that second phase, right, of transmisión comunitaria. We have no idea where this is going to go, but people are prepared to. They understand colectividad and sacrifice, and I think that's what we're seeing here. You know, I mean, I'm amazed. I'm amazed at the discipline also of the people in the communities. You know, and we're doing our work just like we are now. We're using Zoom, and we're talking to people in the communities, and our kids are organizing their own households, and we're moving forward. You know, we're moving forward as a country. There are 11,500 hospital beds being prepared. There's a COVID hospital being prepared right now with 1,000 intensive care beds. Now, do we have ventilators? Probably not. So people know you get sick, you're probably going to die if you're vulnerable. So for us, our emphasis has been don't get sick. Like you were talking about in Ecuador, you know, we're really defending our communities. Everything, our people live so close together. We have very fragile people living with youth. Everyone lives together in very small spaces. So for the disease, the virus to come into our communities, into our zone, as we call it, it would be completely devastating. So here we're taking a really proactive position, you know. People are staying home. People are respecting that social distance. And we really think we're going to stay ahead of it. I think we're ahead of it right now. We don't know, you know, where we are on that curve. We're really just beginning. But we have food, we have frijoles, we have maíz, we have our own water, and we're prepared to go as long as we have to. You know, we're going to defend our communities, and that's kind of where we're at right now. I'll take a question if you'd like.
Well, that's fantastic, John. That's really, you know, I hope that all communities can have that kind of spirit to take this on, and because we're 15 minutes over the hour, not a wasted second of this webcast, but we want to thank everybody. Ken Patterson, who came on recorded, Barb Netterpel from British Columbia, Marco Castillo, Laura Carlson, Natalia del Campos, Alejandro Castillejo, Natalia Green, and you, John Giuliano, thank you so very much. We will be in touch with all of you. We really, really, truly, from the bottom of our hearts, appreciate this. And thanks to Ashley Klein, who's been behind the scenes making all of this happen. Take care of yourselves, and good night. We'll be in touch.
Thank you.
Thank you. Bye-bye. Stay safe.